Today is going to be a good day, family. Welcome to the podcast. I am your host, Regina Lynn. On this podcast, we cultivate a safe space where we can confront uncomfortable conversations. In addition, we strive to create a world where every individual feels prepared, secure, and confident in the plans that they have for the future, knowing that they have provided clarity and peace of mind for themselves and their family. Let's get started in today's episode. Hello, family, and welcome to today's podcast. We have a guest with us today, and I am so excited about our topic. We're actually going to discuss advanced medical directives. And today we have with us Dr. Retha Nesbitt. She hails from Goose Creek, South Carolina. And what we're going to do is we're going to go ahead and jump right in. Dr. Nesbitt, can you please share with us your experience about advanced medical directives?
Good morning, Regina. First, I would like to thank you for allowing me the opportunity to come on and talk about my experience with various legal documents that we should have regarding our healthcare and our family. I want to begin with talking about the advanced directives. Some people call those a living will. That's probably the most common directive that individuals will have. And that legal document provides instructions for medical care, and it's only used or it only goes in effect if you are no longer able to express informed consent, or, in other words, you cannot express or communicate your wishes. And an example for that for me was when my brother had a stroke back in February of 2024. He was paralyzed, and he is also, well, I should say, he's paralyzed on his right side, but he's also unable to communicate. And with that, it was difficult having certain care provided for him at the time because he was unable to communicate and he didn't have any documents in place for his wife or for myself to have certain procedures and certain things done. And the most difficult, and I think the most challenging part, was they give you documents to sign.
Oh,
And that because he's paralyzed on his right side, he writes, of course, with his right hand. And so he would have to make a scribble with his left hand because cognitively he understood what was being said.
right.
He just couldn't communicate.
Okay. Wow, that seems very challenging. So, do you find that oh my goodness. So how did your family manage that space? Were you all worried? Did the healthcare professionals give you a sense that his scribble wasn't an appropriate signature, or how did that work? How did you all navigate that space?
So because they knew that he was paralyzed and that he only had use of his left hand, they allowed the signatures because they saw him sign.
Okay.
Right? But it was challenging again for the family members because after a few days of him being in the hospital, he wanted to go home.
Oh,
And he felt that was his safe space. Everyone wants to be home, but during that time, of course, home wasn't the best place for him to be. And so that
right.
was challenging because then he started refusing medical care.
Wow. I often wonder about that. And since you experienced it, so everybody, like the healthcare professionals, the family can see that you need to be here in the hospital. However, the patient themselves, like, no, take me home. So navigating that space, being that, and then even like he had a stroke, how do we know? I know we're not medical professionals, but how do they know that this person is even coherent enough? Not necessarily coherent, but in a state of mind where they can make sound decisions.
Well, they do tests, right?
Okay.
So that's one thing that they do. But even with those tests, the way that the law is written, if you don't have certain legal documents in place, again, that individual is responsible for their care. And I know you've heard stories about family members having to go to court
Yeah.
to receive guardianship over family members. And the purpose of that is to make decisions on behalf of that individual. And so when a person does not have those documents, again, there's not much that a family member can do. Yes, they will sign them out against medical advice. So you're signing out ADA, knowing, so that protects the hospital to say, hey,
Right.
you need to be in here, but you're leaving against our wishes.
Right. Okay. So they will advise you, okay, it's not good for you to go home. However, we can't make you stay. I never understood that. And one day on this podcast, we're going to have a medical professional to come in and tell us why is it okay to send somebody home knowing that they should be in the hospital. Okay. Thank you so much for sharing that with us. So now that you're on this side of that experience, what do you think we need to do to prepare for something that may happen? Again, I'm sure that you all were living your lives as you normally do. And then you all get the phone call that your brother has to go into the hospital. So now that you're on this side of that, what advice can you give us to prepare for that phone call or to make sure that we're prepared just in case our family gets that phone call?
I think being proactive as opposed to reactive is so much better. And for us to be proactive in the care of our loved ones and even for the care of ourselves, I think that conversations need to be had. Conversations regarding advanced care planning,
Right.
conversations whether or not should you have a medical power of attorney. And I would definitely recommend having a medical power of attorney because again that names an individual that you
Mhm.
trust to make decisions, to be able to express your wishes and make healthcare decisions for you if you're unable to speak for yourself. In many cases, I think that many people that we know, they don't have the medical power of attorney, the
Right.
living will. And for me, another example of something that I went through because my mother did not have a medical power of attorney.
Um,
She passed away when I was 23 years old. And with that, the day that she passed away, she had a grand mal seizure.
oh, wow.
And so, but I will say conversations that we had throughout my childhood. And I mentioned advanced care planning. So those are discussions that you have with your loved one regarding future decisions regarding your health care. So we had discussions,
Right.
but there wasn't anything in writing. And so her discussions, because she was always ill and she always
Mhm.
said to me, do not put me on any type of life-saving
Mhm.
apparatus, right? I don't want to be on life support. Please let me go peacefully. She said that I just, as long as I can remember, but
Right.
as a child growing up, you never knew that you had to make a decision, right?
Right.
You always think that your parents are going to be here forever.
Mhm.
And so at 23, I had to make a decision to put my mom on life support or not, right? And
Wow.
the decision was not to put her on life support. And when the doctors came to me and say, "Hey, we need to put her on life support. What do you want to do?" And I had to pause. I had
Mm.
to deal with my feelings and emotions of, hey, I might be losing my mom right now. And at 23 years old, that's a difficult time. And that's a
Mhm.
very difficult decision as a 23-year-old, and you're making it by yourself because you're the only one at the hospital with her. But I had to honor her wishes.
Yes.
And her wish was to not be placed on any life saving device. And I
So,
made the decision.
and I'm glad that you did that because it was very important that you follow her wishes. Sometimes, and it's great that you didn't have to think about it or weigh different options. And I say that because at least you all had conversations. In that instance, and I've seen and I've heard various stories where there were private conversations between a mother and a daughter, a son and a father, or just children or sisters, siblings, aunts and uncles. it was only between those two people. But then you have the dynamic of other family members coming in saying, "Oh no, mama didn't want that. I don't believe you. You didn't have that conversation." They start saying really bad, evil things to the person that has to make the decision. Like, who left you in charge? Or you just want to collect the insurance money, just all of that garbage. I call it garbage. It's actually nonsense, especially when you're in a moment just so critical and sensitive. So I know that's what we're talking about, advanced planning. You all had conversations, and I'm sure I will answer this question. Were those planned conversations, or were they just conversations in passing, or just because we're sitting here watching TV?
I think for her, they were planned conversations
Oh,
because I am her only daughter and she had other medical issues. She dealt with partial blindness. And so they were planned for her. And she would do it at various times. We could
mm,
watching television, or I could be in the kitchen watching her prepare a meal. I'm in the kitchen helping her, right? So it was at different times, but she often talked about it with me. And it was me as opposed to my oldest brother because he was away in the military.
okay.
And so I was the one living with her and my youngest brother. And so
Mhm.
she always said I was the one with the level head. But as a child, again, you just never
Yeah,
think
right,
that you would have to do that. But just to go back to something that you said about family members and others coming in to say this isn't what she would have wanted.
right,
I think that having those conversations, yes, the individual who has to make the decisions based on conversations that have been
right,
said or had with that individual, again, there is some stress involved with that because after the decision had been made to not put her on life support, then I had the responsibility of calling my aunt, calling my siblings to say she had passed away.
right.
And then the question is, what happened? Right. And so, in the
Yeah,
midst of saying what happened, I had to give the entire truth about what happened and the decision that I made. And family members did not really agree with the decision, but
right.
felt peace with the decision because I knew what she wanted.
And that's another thing, just being able to articulate that and own it, like own the decision that you made. And again, I'm so glad that you and your mom had those heart to heart conversations. So, being on the other side of this, and I know we talked about this with your brother, what I hear you saying is we need to sit down and have something in writing so that it makes it easier for your family members to carry out your wishes and to also have those difficult conversations with other family members so that it's clear. Just read the papers right here in writing. She signed it, she notarized it, and this is what she wants, and this is what we're going to do. Did you deal with any, I guess, guilt or any internal feelings actually carrying out someone's wishes, even though you didn't really agree with the wishes?
I did. I don't think I did immediately after, but
Mhm.
I think some time went by. And when I say
Right.
time, I honestly think years went by. And I think what
Wow.
the trigger for me was I had and I still have a first cousin. She made the decision for her mom to put her on life support.
Right.
And she was months and months, maybe even a year or two. And eventually she woke up. And so for me, um, seeing that and talking with my cousin about it, I think that when I started doubting my decision, although it was my mom's wish, right? I
Right.
was like, well, what if I didn't make that decision? She could have
Right.
still been here. But the question is, could she have still been here? I don't know that because I can't play God in that situation, right?
Right. Mhm.
Everyone's situation is different, but yes, it did allow me I did feel some guilt and did I make the right decision? But I always
Right.
had to bring myself and center myself back to this is what she wants.
Okay. Wow. And that makes it easy. That makes it it's difficult yet easy because you're really not making a decision. You're just making the decision to carry out their wishes. Okay, that's really good. And what I tell people is you mentioned something earlier about when you are selecting people, you gotta select someone you trust. And so let's talk about things that we need to consider when selecting someone to advocate for us. Like, for example, someone you trust, someone that share your same religious beliefs and values, someone that's strong enough to handle or have conversations with that difficult family member or even the medical professionals. Like, what are your thought processes? What characteristics or qualities that we should look for in someone that we trust to advocate for us?
I think that word, to be an advocate, because we know that in the medical field, when we have loved ones who are incapacitated for whatever reason, they need someone who will speak up for them, someone who will be bold enough to confront a healthcare provider. Because I think sometimes we think that, oh, they're the healthcare provider, they know what's best, right?
Mhm.
And they may know what's best, but keep in mind, they have many patients that they're seeing and someone who's going to advocate for you. And I'll give you another example. In August, I had to fly to North Dakota to see about my brother. Uh,
Okay.
he was ill, very ill. They didn't think that he was going to make it. And he had this infection that they just could not get rid of. And so when I got there that night, I stayed with him the entire time in the hospital. But the night
Right.
I arrived, he had an episode where he was vomiting blood
Oh, Jesus.
and they had to come in and do some things with him. But the following morning, I was waiting on the GI specialist to come in, and he never showed up. And so I kept asking, "Where's the GI?" Because he needs to have a GI workup because there's
Mhm.
something going on. And I kept getting excuses. And so finally, I said to the primary care doctor, and he was actually a hospitalist who was on call. I told him, I said, based on what I was told last night, I still have not seen the GI provider.
Right.
I want to see him. And I went in and I gave him the hospital's policy. And the hospital's policy
Mm.
that if there was a consult from another provider, that provider had to provide the consult within 24 hours. And
Okay.
so I reminded him that 1 a.m. would be 24 hours, that I was going to be up and waiting for him to come in, and
Right.
that I have worked in this profession and have worked with many providers. And I went online to see what the
Right.
policy was, right?
Yeah. Let me stop you for a minute. So, how would I know? How would I have known to do that? Like, how do I know what the hospital policy is? So tell the family here, how do we know? How do we know to do that? How do we know what the policy is?
So you can ask, you
Okay.
can go online for that hospital and see if it's online. If not,
Right.
you can ask the charge nurse and say, what is the hospital policy? If there's a consult, how long does that physician, how long that specialist, how long does he or she have to come in to see my loved one? They
Right.
have to tell you what that policy is.
Right.
And so once I said that, I kid you not, within 20 minutes, that specialist was in the room
Wow.
talking to us about the next procedure because I said to him, he needs to have an endoscopy. That's the only way we're going to find out what's causing this. You're going to have to scope him. So here I am talking to the doctor, the specialist,
Right.
right? And I know he's looking at me like, how does she know?
Right.
What
Because we're looking at you like, how do you know? How do we know that what did you call it?
endoscopy?
Endoscopy. How do we know? How do I know that he needs an endoscopy?
That's a difficult question to ask because
Okay.
again, I have worked with various providers. In my profession, I do medical billing and consulting and revenue cycle management for physician
Right.
offices. And so because of that, I've worked with various specialists.
Right,
And
right.
so I know the different procedures that need to be done or should be done or can be done to help answer questions. And so that was the first thing I said, when is this going to happen?
Right,
And I
right.
say,
Okay.
and so then he went through that process, ordered the scope, and that's when we found out it was something simple. I say simple, but because it had reached they call it stage D, in this case for reflux, he had acid reflux. But because it had been left untreated since July,
Oh my Jesus.
because I found his first episode was when I was in Indianapolis in July. But it
Right.
had what he wasn't eating. He wasn't really drinking anything. And from July to August, he lost 24 pounds. And so once they did the endoscopy, found out that it was reflux, that it was stage 4, they immediately put him on this medication. Right.
Mhm.
And then for him, he had to sit up 30 minutes to 45 minutes after eating. Guess
Right.
what? It solved the problem. He was able to eat, he was able to drink, all of that.
Right.
One
Okay.
test, but had
One, two.
not had that test, I don't
And
know.
then it goes back to what you said when you went to visit him in the hospital. Had you not been there to advocate, we you probably will be telling a different story today, right?
I believe so.
So selecting the right person to advocate for you is so key and so important. I just believe that. And I tell a story that a lot of times I say, who's going to advocate for me? Because when I walk, my family will tell you, they will tell you, if they go in the hospital, call Regina. And not because we've had conversations about what to do now that this podcast is alive and it's doing what it's supposed to do, I'm going to have more conversations with my family and get them to write things down. I will say though, if something happens today, or even without any written plan, my family, my siblings for sure, they say, Carl Regina, I don't know what happens. When I walk into that hospital room, something just instantly clicks. I don't know what it is. I want to make sure I know what's going on. I want to make sure that my family member is comfortable. I want to make sure that they're not in any pain if they're able to eat. Like I want to make sure. And I truly, truly advocate for them. And so I often say, who's going to advocate for me? Because I want you to advocate for me like
Absolutely.
I advocate for you or
Ab-
like I will advocate for you. And it's
Absolutely.
not really a tit for tat. I just know it's just something that just happened.
Yes.
It's just something that happened. And I will tell you this, I believe someone that has a plan in place versus someone who doesn't, they're in a space where they can actually heal in peace
Absolutely.
because they don't have to worry about nothing because my advocate is worrying about that. So what are
Absolutely.
your thoughts, Dr.
No,
Nick?
I totally agree with that. And I'll use my brother, but in his case, he has 24-hour care.
Okay.
And the company that assists his wife, because he is married, they send pictures to me when they have him out doing physical therapy. They will call me. Although I'm the sister and his wife is
Okay.
there, they often tell him, we're calling your mother. Because
Oh,
most people will say, they always say, I raised him after my mom passed away. And
right,
so
right,
so I'm still involved, although I'm not here. I'm not in North Dakota with him. I'm still
right,
involved. If I have a question or anything, I can call that provider.
right,
When he's at his doctor's appointments, if I need to be on camera, they discuss that, hey, they will call me FaceTime so that I
right,
can also be a part of the conversation with the
right,
provider.
right,
So again, when you talk about advocating, all of that is still not just advocating in the midst of the crisis, but also
right,
being their advocate after the fact when they come
right,
home, when they're in physical therapy, speech therapy, all those other things that they may need, still advocating for them. Because guess what? If you still don't have the right provider at
right,
home healthcare provider, right? Then everything that happened before is not, because in my brother's case there was an issue with the provider. His wife had to step up to say this behavior will not be tolerated,
right,
and she went to the owner. and there had to be some corrections made. But if she
Right.
was not advocating for him, then they would have thought that if he rings his bell, we don't have to respond immediately. But if he rings his bell, you need to jump up and see what's wrong.
Right. That's what
That's
you're there
still
for.
advocating. That's what you're
Right.
being paid to do, right?
Right. So it sounds like two things here. It sounds like you and your brother's wife have
Yes,
a healthy relationship.
we do.
And I say healthy because both of you are, you're not like, I'm in charge, I'm in charge, I'm his wife, I'm his sister, I'm his wife. You're
Absolutely.
like, let's get together and take care of your husband and my brother. And so let's talk about that for a minute, if you don't mind. And if it's not too personal,
Hmm.
having that relationship with his wife, and I'm glad it's healthy, but it's not always healthy because you could be threatened because that's his wife, and she could be threatened because you're his sister who pretty much raised him as a mother. So that can be, again, envious and jealousy that can get in the way of true care for your brother and his wife. So can we talk about that healthy relationship that you have with his wife and how you all are navigating this space?
I think, and we do have a healthy relationship, and I'm so thankful for that because if anything goes on, anything at all, she is going to call me.
Right.
And I think it just starts in the beginning. We have always had an open communication. When he was well, right? We had a great conversation. If my brother, of course, he's not perfect. If he did
Mhm.
something that frustrated her, she will pick up the phone and say, "This is what he did." And I would say, I think what helped us is I don't take sides.
Right.
Oftentimes, we want to take sides because it's our family member.
Mhm.
And I'm of the mindset if you're wrong.
Period.
And I am not going to stand up for you or make an excuse for you or
Mhm.
and say just because you're my brother, you're my sister, I'm on your side if you're wrong. And I think
Right.
that's what my sister-in-law respects because I'm not going to do that. And
Right.
I think
And
that helped our relationship.
it sounds like you all cultivated this relationship before it was a
Absolutely.
crisis, before it was a need, before your brother or her husband even had to go to the hospital. So that is great. And that's something that the family here can take from this podcast today, is that cultivate these relationships before you need them. And not necessarily before you need them, just so that it's a steady flow. If you're healthy outside of the crisis, in the crisis, you'll be healthy and level headed in order to get whatever needs to be taken care of, accomplished.
Absolutely.
Yeah. Yeah. So, Dr. Nesbitt, as we wrap up this episode of podcast, I definitely want to say thank you. Thank you for your transparency and sharing your personal story with us. Do you have any final words here to share with our podcast family?
The one thing that I will say, have those difficult conversations. And they are difficult, especially as a parent having it with your children, because our children do not want to hear those things. They don't want to have that conversation. My daughter says, "Oh my goodness, you're making me sad." Right. But it's
Oh,
okay because we need to have that conversation because I'm not going to always be here.
right,
Right?
right,
And so having those conversations, making sure that you choose the person who will advocate for you,
right.
right? And just making sure that your family, and I'm not just talking about your children, those siblings, your aunts, your uncles, make
Mhm,
sure that they understand that if it's a difficult situation and you need to make a decision regarding your parent, that
mhm,
do not put extra pressure on you because they think they know.
right,
Because a lot of those conversations are had with the children and not with sisters and brothers,
right.
right? In many cases. And so we just have to understand that it's a difficult time for everyone, but putting pressure on someone, trying to make them feel guilty in that moment is not the
Yeah,
right thing to do. Because when you talk about relationships, those are the things that end relationships. And we're not
right,
here to end relationships. We want to grow relationships. We want to grow the bond that we have amongst each other. So
right,
again, just have the conversations. It doesn't matter how difficult it may be, and just making sure that the family can come together, not pull apart during that time.
right, right. Okay. Thank you, Dr. Nesbitt. And the only thing that I would add to Dr. Nesbitt's closing remarks is after the conversations, put your conversations in writing. So that concludes today's episode. Thank you all so much for connecting with us, and we'll see you next time. Peace.
Goodbye. Thank you.
Thank you for connecting with us on today's podcast. We are dedicated to helping families navigate life's most challenging moments, providing peace of mind for themselves and their loved ones. Until next time, hug yourself, love like you've never been hurt before, and straighten your crown. Peace.